Hi, welcome to Case of the Day, and today we have our 59th case. So we've actually finished 15 weeks, and this is the last case of the week. So that's kind of 3.5 months, and that's a long time. So today the topic is the scourge of bleomycin. So this 18-year-old with Hodgkin's was on ABVD. At the end of 5 cycles, a follow-up PET was done. Patient had fever, dyspnea, cough, and you can see ill-defined centrilobular nodules and coalescing subtly into areas of ground glass. This is an HP pattern. Patient was worked up for infection, tropical eosinophilia, all negative, in which case this is consistent with bleomycin-induced lung injury. My go-to paper for all medication-induced pulmonary injury is this one that came in Radiographics 3 years ago, headed by Shravan Sridhar. And this one, in fact, Dr. Lauren Ketai gave a lecture on this subject at our REF Cafe Rengen meeting a couple of years ago. And in this paper, and this is known, you have these 6 types of lung injury: sarcoid like, ground glass, fibrotic, OP, and the centrilobular ground glass nodules, which our patient has. And these are the various drugs that can cause these injuries. And at ctchestreview.com, I've looked at 2 such cases. This patient had nitrofurantoin-induced lung injury, and this patient had nivolumab-induced lung injury on the background of pre-existing ILA. So you can see that in the index here, and you can go and look at them if you want. But from the same radiographics paper, a little more about bleomycin. The prevalence varies depending on what the diagnostic criteria are. Mortality can be high. Toxic effects are dose dependent, but they can manifest many years later. And it's because of DNA damage due to the high O2 content in the lungs. And in fact, one of the first papers on this subject, CT related, was 40 years ago in radiology, and at that time terms like organizing pneumonia etc. were not known, and you can see these OP patterns in both these patients here. There were about 3 or 4 papers written by Dr. Bellamy at that time, and it's very interesting to see these. But bleomycin can exhibit a varied pattern of involvement, so I looked at my archives. And this is a 52-year-old bleomycin-induced lung injury, normal lungs in August, then this OP pattern in December, and then improvement later. So this patient did well. This is another patient who had progression over 3 months, but my notes then say that the patient improved, and there were a subsequent couple of scans. I don't have the images where the lung lesions were described to have improved. This patient received bleomycin for germ cell tumor and had a severe injury with a mixed NSIP-OP pattern, some pneumomediastinum here, which is never a good sign, and I don't have a follow-up of this eventually. And this patient, 50-year-old with germ cell tumor with bleomycin, this was actually cystic metastatic disease that improved, but the patient started landing up with lung injury here. This is an NSIP-like pattern, but eventually full-blown diffuse lung injury with fibrosis, with pneumothorax, with pneumomediastinum, and I don't have a follow-up, but these patients never do well when it reaches this stage of disease. Our index patient came yesterday for a follow-up CT, and you can see that the lungs are completely normal and resemble what was there 6 months ago. So this is 2 months. This is index at 2 months, 4 months. So 4 months after this. Anyway, basically everything's regressed after the patient was given steroids. So that's very good news. And it's always nice to see something improving. So each time we see an interstitial lung disease, especially if it's acute, subacute in patients who are undergoing treatment for tumors or other chronic conditions, we must keep in mind the possibility of MIPI, or medication-induced lung injury, which can present with any pattern of ILD. Common are amiodarone, nitrofurantoin, and then multiple anti-cancer medications. Currently, our largest cohort of medication-induced lung injury is with the immune checkpoint inhibitors like nivolumab, where we see a lot of asymptomatic lung injury when we're doing follow-up PET scans. Whether it's for lung cancer or other cancers for which they receive these ICIs or PDL1 inhibitors. So that's the WhatsApp channel, and I'll see you next week after four days. Thank you so much for viewing this.